Hello, cruel world. Today's episode is about when it is suitable to see a psychiatrist. So what are the issues that a psychiatrist can and can't deal with? What situations are too severe for a family doctor to deal with? What's the difference between a psychiatrist and a psychologist? And will you get to see the senior psychiatrist or the junior doctor? I'm also going to tell you about the tragic case of a poor psychiatric assessment which contributed to his suicide. I'm going to answer all these questions and many, many more in this episode. So sit back, grab your copy of the DSM-5 or your ICD-10 manual, and welcome to A Psych for Sore Minds. As always, we're going to start off with a story. So I'm going to tell you about a real-life tragic case. And this really highlights how the system goes wrong with poor psychiatric assessment. So Adam Stanmore is a 37-year-old man of mixed heritage from Oxford. And he was found dead on the 13th of June 2019, and it was a suicide. He had a self-reported history of depression and he had type 1 diabetes. Now I've done a more detailed video on him, so you should go and check that out. The cynics amongst you might be saying that I'm just recycling the same material, and to you I would say, so very briefly, on the 23rd of April 2019, Adam contacted his GP and he reported these kind of paranoid thoughts and that he was hearing voices telling him to kill himself. And Adam was referred by his GP to the Oxford Health NHS Foundation mental health team, and he was seen on that same day, which is quite impressive. However, following this assessment, Adam was just given a post-it note with the telephone number of Mind, which is like this mental health charity. And then he was told to go back to his GP for antidepressant treatment. So obviously it goes without saying that this is substandard. And it's hard to judge the degree of how bad this assessment was without seeing the notes. So it depends on his risk assessment. So for example, if he said that he was feeling safe by himself and that he could cope and that he had a good support system around him and that the voices had stopped or they weren't bothering him, then arguably it might have been a reasonable assessment. But I think that's really unlikely given his presentation to his GP on that very same day. So on the morning of the 18th of May 2019, Adam left his mother's house and he left a note which stated that he'd had enough. In the early afternoon, he obtained a knife from a neighbour, and that neighbour called the police. And Adam was found sitting on his own fence, and he was quiet and he was staring ahead, and he told them, "I want to kill myself." So the armed response officers arrived and they approached Adam. They saw the knife in his waist belt and they discharged their tasers and they used force to restrain Adam and to remove the knife from him, which to me seems quite heavy-handed. And then Adam said he wanted to kill himself and he was taken to hospital. A public inquest was recently published, and it found that there was an inappropriate handover of information between the ambulance service control and the paramedics who were sent to the police station, and also between the police custody staff and the paramedics. And the evidence suggested that the paramedics weren't even made aware that Adam had told police officers that he wanted to kill himself. So to me, this is a very sad tale, and it teaches us what can go wrong. So moving on, we want to know when to see a psychiatrist and when not to. I think a common misconception is that psychiatrists carry out regular therapy. So psychotherapy is when somebody sits with a patient for a structured amount of time, usually 1 hour per week, or sometimes group therapy. So the vast majority of psychiatrists do not do this. Psychiatrists like myself, we're doctors first, so we have to complete all of medical school, and then we train in the medical aspects of mental health, such as diagnosing, prescribing medications. I think it's confusing because some psychiatrists, a small minority, then after that, they choose to specialize in psychotherapy. However, this is not common. A psychologist doesn't study medicine holistically like a psychiatrist does, and they only specialize in thinking and emotion rather than the physical human body. So for example, they can't prescribe, but they do have expertise in long-term talking therapy. So they're the ones, not the psychiatrists, who sit down with a patient on a regular basis. They talk about emotional issues. So psychiatrists generally wouldn't see a patient as frequently as a psychologist, like on a weekly basis, unless that patient was going through an acute crisis. And psychiatrists' appointments are generally much shorter. So psychiatrists deal in mental illness, such as depression, schizophrenia. Psychologists sometimes deal in mental illness, but they can also deal with emotional problems that are not related to mental illness, such as family therapy, couples counselling, sports psychology, confidence building, anger management. So all of these things that are not definable mental illnesses. There are, of course, many other differences between psychiatrists and psychologists. I might do a separate video on this. Tell me, viewers, if you're interested in seeing this, let me know in the comments. Having said all that, a psychiatrist can refer to a psychologist, and they often actually work together on the same team. So if a psychiatrist thinks this person doesn't need medication, doesn't need hospital, but they need talking therapy to deal with emotional problems, they might refer them to a psychologist. So just to kind of reiterate, you should only see a psychiatrist if you think you have a mental illness, bipolar, depression, schizophrenia, as opposed to just an emotional problem. In the same way that you'd only see your family doctor if you were actually ill, as opposed to like lifestyle issues like losing weight or improving your diet or dealing with your stinky breath, which we both know has been an issue for quite some time. So next question, when do you see your GP versus when do you see your psychiatrist? It's not really your problem because it's the GP's responsibility to refer you if they think it's necessary, but I still think it's educational for you to know. By the way, for our foreign or maybe US viewers, GP is what we call family doctors in this country, general practitioner. Firstly, basic psychiatric problems can be dealt with by the general practitioner. So your GP knows a little bit about all types of medicine. He or she is like the jack of all trades. So they can help treat basic arthritis or diabetes or minor depression. However, when it gets complicated and the patient needs ongoing help and they need long-term specialist detailed input, then the GP refers to a specialist, which might include a psychiatrist. So psychiatrists generally have a more intimate knowledge and experience of lots of different medications and more severe psychiatric illnesses. They've often worked on psychiatric wards, and obviously they deal with a higher level of illness. Sometimes people have been sectioned or detained under the Mental Health Act. By the way, I've done a completely different video on the process of being sectioned, what to expect. Go check it out. Also, psychiatrists might be more used to dealing with specialized medications like antipsychotics or mood stabilizers. Your average GP might not have that much experience in that. But then later, if the psychiatrist has stabilized the patient and they don't need such a high level of support anymore, the psychiatrist can discharge them from their service back to the care of the GP. Okay, Dr. Das, stop beating around the proverbial bush. What are the specific situations that a GP might refer me to a psychiatrist? Chill out, I was just about to get to that. So if you have a very distressed patient who's easily agitated, it might not be suitable for them to go to the environment of a general practice surgery because it might disturb other patients. So they might be more suitable for a psychiatric clinic. Also, in the UK, GPs are pressed for time. So generally they have around 15-minute windows to see the patients, including taking the history, examining them, writing up the note. Not a lot of time, and they can't go into much detail, whereas a psychiatrist can. Also, in a psychotic illness, as opposed to a neurotic illness, it's more likely the GP deems this to be out of their area of expertise. So psychotic illnesses are things like schizophrenia, where people suffer from delusions and hallucinations, out of touch of reality. See my separate video on schizophrenia if you want to know more about this. Whereas neurotic disorder tends to be things like anxiety or depression, where the patient understands that they're ill. So in psychosis, they often don't have insight, and therefore, if they don't have insight, they don't believe they're unwell, much harder to treat. For example, they might not take their medication. Another situation is if there's a high level of risk, such as deliberate self-harm or suicide or even violence. It's very likely that this person might need to be hospitalized, even sectioned. I can talk about this, that's literally what I do for a living as a consultant forensic psychiatrist. Also, if a GP has tried to treat a patient but is struggling, so for example, if they've prescribed lots of different antidepressants and they don't work, that's another reason to refer them to a psychiatrist who might try different medications, combinations, higher doses, unusual medications, etc. By the way, dear viewers, I would like to know your stories about your psychiatric treatment, either with your general practitioner or your psychiatrist. I would love for you to share your experiences. If you feel comfortable, let me know in the comments. Next question, do you get to see the psychiatrist or do you just get fobbed off with the junior doctor? Before I answer that, I would like to introduce you to this channel. So you are watching A Psych for Sore Minds, hosted by me, Dr. Sohom Das, Consultant Forensic Psychiatrist. I assess mentally disordered offenders in courts and in prisons and in psychiatric units This channel, A Psych for Sore Minds, dissects a whole range of topics related to mental illness, criminality, violence, sometimes the crossover between the two. Sometimes I look at high-profile true crime cases, sometimes I interview patients, sometimes I talk about individual diagnoses, sometimes I answer your questions from the internet. What I'm trying to say is there's something for everybody on this channel. I implore you to subscribe because not only does it help me out immeasurably, but it actually gives you minty fresh breath, and we both know you need it. So let's get back to that question. Do you get to see the psychiatrist or the junior? Here I'm talking about in an outpatient clinic. The whole setup is different in a psychiatric hospital. In fact, I'm happy to do a separate video of what to expect when you see a psychiatrist. Tell me in the comments, dear viewer, if this interests you and if you want to see this. Do you get to see the senior doctor? Well, the dynamics within a psychiatric team is very kind of complicated and convoluted, just like family dynamics, I guess. Just like how your Auntie Lynn is never invited to Christmas and your Uncle Patrick went on holiday for 5 years after he started that fire. Generally, the consultant psychiatrist is in charge. He is a team, which might include a registrar. So a registrar is like a middle grade psychiatrist who's senior and experienced, and they specialize in psychiatry, but they're not yet fully trained, and therefore they're not yet fully independent. Being a consultant to me is a bit like being a made man in the mafia. So you don't have to get backup or permission for any of your decisions. You practice independently. Also, you need to get special permission from New York to get a consultant whack. The senior house officer, confusingly, is more junior than a registrar and mostly a training to eventually become consultant psychiatrist, but not all. So for example, trainee GPs might do a 6-month placement as a senior house officer to get some experience of mental health issues. Now, a bit of a side note, but I imagine some of you are probably curious about ages of doctors, and I've certainly heard a lot of comments about some doctors looking very young. So the youngest that you could be a senior house officer would be roughly about 2 years out of medical school, so around 25. A registrar would be a few years older. You can technically become a consultant as young as 30, but it often takes people longer because they might want to try out some of the other fields of medicine first. They might want to play the fields before they get married to one specialty for the rest of their lives. You know, just like your fiance did at college. Also, another reason to slow down becoming a consultant, you might want to work abroad, you might want to procrastinate not having to sit your many difficult exams. All of those things were relevant in my journey, by the way. Generally speaking, the consultant stays on the team permanently, and the junior staff, the registrars and the SHOs, they rotate on different rotations, so they get different experiences, different environments. Generally, senior house officers 6 months, registrars 1 year. So will you be seen by the junior? Well, it kind of depends on the situations. It depends on how much time the consultant has, how busy he is in his own clinic with his own patients or hers, and also how much confidence they have in their junior doctors and the complexities of your case. So for example, if you are somebody who's very unwell and is suicidal, you're much more likely to see a senior clinician because you're more risky. Whereas if you're somebody who's relatively stable and your presentation is straightforward, say you've already been stabilized on antidepressants previously by a consultant and you're just there for a review of your doses of medication and to check side effects, etc., fairly basic, you're more likely to see a junior. Sometimes the junior might think that the case they've seen is beyond their level of expertise. So they'll ask the patient to go back in the waiting room and they will present their case to the senior consultant psychiatrist waiting for him or her between their clinic patients. And the consultant might either give the junior doctor some advice, or they might say, you know, what you did's fine, your plan is fine, don't need to see the patient, in which case you don't see the consultant, you go on your merry way. However, if the consultant's worried, or if they think the junior's done a shoddy job, or if they've missed out something important, they might want to go back to see you all from the beginning again. Or maybe the junior's very new and this is, you know, the first couple of weeks they've worked in psychiatry. Right, in conclusion, there's a lot of misunderstanding about exactly what the role of a psychiatrist is and when it's appropriate to see one and when it's not. I hope this video has shed some light. I've also done a separate video on, I think it was 8 common misconceptions or myths about psychiatrists. Go 𝐏𝐬𝐲𝐜𝐡, check it out if you want more information. Please do let me know about your own experiences of mental health treatment. I'm really curious. I'd love you to share your stories. Also, let me know if you want to see other videos, specifically what to expect when you see a psychiatrist and what's the difference between a psychiatrist and a psychologist. All that remains for me to say is to show off about my book, which is going going to be called In Two Minds. It's going to be out next March 2022. It's going to be about a whole range of cases that I see as a consultant forensic psychiatrist, similar to this channel, but more scientific, more detailed, more autobiographical. Until next time, spread the love. Please tell everybody you ever meet, your friends and your enemies, about this channel. I need more subs. Stay euthymic, and please do not forget, I love you.